Our site location is at Norwalk Hospital in cardiac rehab. So this is our site instructor.
I'm Joe Mikalchek. So do you want me to do the certification?
Yeah, or like length of time you've worked at the location.
So I've been here for 2 years in January. Started as an intern and got a job here. I'm about to graduate with a master's degree from Sacred Heart, and I'm certified strength and conditioning specialist through the NSCA.
Okay. What's your day-to-day job responsibilities of being a site instructor?
So here, for me, I'm kind of in charge of running the cardiac rehab exercise along with another exercise physiologist and the nurse practitioner. So day to day, I'm just making sure that everyone's getting through their exercise routine as prescribed. Everybody's safe and they're effectively training. And then there's a lot of other things that go into making sure everything's covered with insurance and making sure that all of the information gets relayed to physicians, and if anything does come up, the physicians are aware of how their patients are progressing or regressing in some cases, and they take care of whatever the issue is.
Okay. So what's the general profile of your clients and patients?
Generally, as we're in cardiac rehab, we typically see an older demographic. Not to say that we don't have younger people come in here, we do, but in general, I would say, they're primarily senior citizens covered by Medicare. They have a lot of comorbidities, so they're not only here for cardiac rehab, they have diabetes, they have pulmonary issues, but in general, there's a lot going on medically for them. I mean, there are some cases where young guys who are in their 40s who are ready to start running, but the general demographic is one that is intermediate to high risk.
Okay. So, in your opinion, why are ethics or ethical conduct important in your job?
Well, it's important just because we're dealing with people's lives and people's vitality. So if we're not behaving ethically, then we can end up impacting them. They take what we say very seriously. So if we're not behaving ethically, we can kind of impact their life in a really negative way. If we're kind of stepping outside of our realm of expertise. I'm an exercise physiologist. I'm not a dietitian. I'm not a doctor. So I have to make sure that I'm giving them advice that I'm really an expert in, not telling them how to medicate or how to eat and things like that.
So, based on the document, 10 ethical issues facing health fitness professionals, what's one topic do you see as most relevant to your particular area of expertise, and why?
Okay, so I kind of just talked about it. So, my expertise would be exercise. Mm-hmm. In here, the first thing everyone wants to know is, what should I be eating? What shouldn't I be eating? And I'm glad to offer little tidbits, but in reality...
The final question, can you give an example of unethical behavior in the health fitness profession that you have ever witnessed or heard about?
Being in a hospital, I think the number one thing that maybe I've not seen, but that happens a lot, is HIPAA violations. So that's HIPAA being the Privacy Act. So that's something that you see if people are talking about patients using last names, things like that. I would say that's probably the biggest. In the hospital, that's the one. You see people who talk about patients they shouldn't. I mean, I don't really see it, but it's something you hear about. Is that.
Okay. All right. Thank you.
All right. No problem.